Hi, thanks for taking the time to visit us at the Center for School Behavioral Health at Mental Health America of Greater Houston. The center's mission is to improve the prevention, early identification and intervention, and treatment of behavioral health issues among students. We do this by providing training modules, lesson plans, and activities that are designed to build a school internal capacity to infuse mental health into the campus culture. The Center's School Behavioral Health Collaborative works with 30 charter and school districts and more than 80 organizations in the Greater Houston community to implement 37 recommendations for improving student behavioral health. The purpose of this training is to explore with you, the audience, the possible impacts of media overconsumption on your mental health. There are 2 professional development specialists on our team who are responsible for facilitating our trainings to student-facing professionals. My name is Sharifa Charles, and I'm excited to facilitate this training opportunity for you because I believe in the work that we do with the center, and it is my hope that more schools and districts will prioritize mental behavioral health of their students. I wanted to share a little bit about myself to start. I attended college in the Twin Cities in Minnesota at the University of St. Thomas. I studied community health education there. I have been facilitating and training for over 15 years and have worked with extremely diverse populations, ranging from incarcerated youth to first responders in the Caribbean. I love to travel and dream of visiting Machu Picchu in Peru one day. Here is where we're heading during this video. We will learn the impacts of the different forms of mass media on one's mental health, identify methods to consuming media in healthy ways, and name 3 reputable media outlets for COVID-19 related news and updates. Let us first take a few moments to discuss the different forms of mass media. Mass media includes newspaper, radio, magazines, the internet, and television. I also have to mention an offshoot of the internet known as social media. Later on, we will dive deeper into social media and its unique influence and impact on us today. Mass media has gone through a tremendous shift within the past decade alone. How many of you have heard the term digital disruption? Digital disruption is a term frequently used to describe the way that improving technology has damaged the traditional business models of many industries. The mass media market is no exception. Consumers are demanding constant on-the-go access to content, and providers are being forced to change the way in which they conduct their business. Written media has been forced to also adapt. Let's review some interesting statistics about different forms of mass media. Newspapers and magazines. Written media has also been forced to adapt. Magazine media tells a similar story, with over 34% of magazine audience in 2017 coming from the mobile web. Digital magazines reached an estimated 42% of the American population monthly in 2018. With television, the industry is also a great example. As of 2017, 35% of consumers watch TV in real time versus 77% who now report to streaming television shows or movies in the last month. Only 10 years ago, we were visiting our neighborhood video rental store or having one delivered to our front door. Radio has also experienced the same metamorphosis. As of early 2018, 57% of the US population listened to online radio. As a relatively new technology, online radio is most popular among the younger generations, with the technology reaching 88% of Americans aged 12 to 24 monthly, a figure which falls to 33% amongst those 55 years and older. Making note of the differences in popularity of one form of mass media versus another, among generations can assist us greatly in times like these. It is crucial that we leverage different forms of media to convey important and accurate information to diverse populations. Social media is defined as websites and applications that enable users to create and share content or to participate in social networking. Here are some interesting statistics about social media usage in the US. North America has one of the highest social network penetration in the world. In the United States, 79% of the population had a social media profile. The United States, as the country with the third largest social network user base in the world, is only behind China and India. Projections are optimistic, showing a constant increase in the number of social network users in the coming years. 72% of the American public uses some form of social media. YouTube and Facebook are the most widely used online platforms, and its user base is mostly broadly representative of the population as a whole. A smaller share of Americans use sites such as Twitter, Pinterest, Instagram, and LinkedIn. You might be wondering if social media has a positive or negative impact on our mental health. There are studies that provide evidence for both. Here are some positive impacts social media has on adults and youth. As you can see, some positive impacts on adolescents are connectedness, their awareness, and sharing their experience. For adults, some positive impacts are building community, remaining informed, and increasing their empathy and philanthropy. Here are some negative impacts social media has on adults and youth. As far as negative impacts you will see for adolescents, they may deal with cyberbullying, predation, social comparison, which can lead to depression. And for adults, they may become hypervigilant, also deal with depression, and also deal with anxiety. When we discuss social media and youth, cyberbullying is an issue that often comes up. Let's dive deeper. It is crucial that we talk even more about cyberbullying. What is cyberbullying, you may ask? Cyberbullying is bullying that takes place over digital devices like cell phones, computers, and tablets. Cyberbullying can occur through SMS, texts, and apps, or online in social media forums or gaming, where people can view, participate in, or share content. Cyberbullying includes sending, posting, or sharing negative, harmful, false, or mean content about someone else. It can include sharing personal or private information about someone else, causing embarrassment or humiliation. Some cyberbullying crosses the line into unlawful and criminal behavior. Here are some warning signs to look for if you suspect your youth may be being cyberbullied. They may become upset, sad, or angry during or after being online or using their phone. They withdraw from family or friends. They express reluctance or refusal to participate in activities they have previously enjoyed. You notice an unexplained decline in their grades. They refuse to go to school or express anger or dissatisfaction with a specific class or school in general. You also may notice an increase in reports of symptoms of illness for which he or she wants to stay home. There are also times where you may notice signs of depression or sadness. Here is a list of some of the emotional, physical, behavioral, and mental signs and symptoms of the impacts of the overconsumption of media. It is important to clarify the difference between signs and symptoms. Signs can be seen. If someone has a cold, you may witness them sneezing. Symptoms are experienced by someone, but are not always seen by those around them, i.e., a stomach ache. Unless they tell you, you may not even know. On the bottom right-hand corner, you may notice under the category mental, the word xenophobia. Xenophobia means fear or hatred of foreigners, people from different cultures, or strangers. Some of you may have witnessed stories of persons of perceived Chinese descent being verbally and physically harassed all over the world. This is due to the perception that coronavirus, also known as COVID-19, started in China. We are also seeing Asian countries that are carrying out policies that hinder people of African descent receiving housing, healthcare, etc. The reversal is important to highlight and immediately discontinue. Oftentimes, these ideas of the perpetrators are being fueled and spread by mass media. Mass media is a powerful tool, but only when used responsibly and for the improvement of all of our lives. Despite the effects of social media that it can have on youth, there are safety measures we can take. Caring adults in their lives can take measures so that their youth can engage in social media safely. Youth can also establish ways they will use social media in healthy manners. For youth, they can block online haters. If someone is making negative or hateful comments on their post or account, they can block them. They can remind themselves that comments from haters are a reflection of them and aren't really about them. People who feel good about themselves don't need to put others down. They also can understand criticism can be a sign of pain. People sometimes lash out because they have other life struggles. They can acknowledge their feelings, and they need to keep being themselves, keep moving forward, pursuing their interests, and being who they are. As far as parents and guardians, they can monitor a teen's social media sites, follow or friend a teen on social media sites, stay up to date on the latest apps, social media platforms, and digital slang used by teens and children, establish rules. It is important to be patient with your child if they start to get irritable and frustrated. They are trying to reconcile this new reality like adults are. Moreover, children are probably not going to be as good at hiding their emotions or redirecting them like adults. Allow and support children when it comes to FaceTime or Skyping with their friends, as well as live streaming on apps. Research has shown that socializing and connecting with peers is essential for their continued healthy development, especially in the midst of chaos and uncertainty. Encourage physical activity without doing so in a group setting. Physical activity is necessary at all ages to calm the mind and support cognitive growth. If you are an educator or engaging with students online, here are some safety measures you can take. In your online learning platforms and environments, set expectations and standards immediately and clearly for respectful behavior among students. Determine exactly what consequence you can implement for rule violations and make sure they truly have a deterrent effect on students. Keep close tabs on all online interactions and encourage your students to send you screenshots or screen recordings if any rule violation takes place. Model and reinforce positive peer interactions in all venues. Most importantly, keep in touch with those you know who need a deeper connection, encouraging words, or accountability. When using mass media, we recommend youth and adults use reliable outlets, set a time limit to ensure they are not consuming too much, and use good information to improve their lives and the lives of those around them. I wanted to take a moment to share with you 4 reputable COVID-19 information sources. More than ever, we must ensure that we are receiving our COVID-19 related information from public health and research authorities. Based in Atlanta, Georgia, the Center for Disease Control, also known as the CDC, increases the health security of our nation. As the nation's health protection agency, the CDC saves lives and protects people from health threats. To get the latest public health information relating to coronavirus from the CDC, please visit www.coronavirus.gov. The National Institutes of Health, NIH for short, is one of the world's foremost medical research centers. NIH is an agency of the U.S. Department of Health. To get the latest COVID-19 research information from the NIH, please visit www.nih.gov/coronavirus. I would also recommend seeking information from the FDA and WHO. The FDA, better known as the U.S. Food and Drug Administration, along with other federal, state, and local agencies and public health officials across the country, continue critical work to protect the public health during the COVID-19 pandemic. The World Health Organization's primary role is to direct international health within the United Nations system and to lead partners in global health responses. When you visit the websites, you will see a variety of links to redirect you to their pages and resources relating to COVID-19. All 4 organizations have their own apps, podcasts, in case you prefer to receive your information in that manner. To wrap this training up, I would like to finish with a quote. Social media has become a space in which we form and build relationships, shape our self-identity, express ourselves, and learn about the world around us. It is intrinsically linked to mental health. In case you are seeking more information, here's a list of the references. Thank you for joining us today. For more information about the Center for School Behavioral Health Trainings and Events, please contact us at csbhinfo@mhahouston.org. We would greatly appreciate if you would take a few moments to take this quick survey so we can continue to improve and provide the trainings you need the most. Take a moment to go to www.surveymonkey.com/r/COVID-MMMH. Thank you again and have a great day.